Why don't we go for it? Once again, Candace, do you want to introduce yourself? And then we'll dive in.
Once again, my name is Candace Morgan. I'm with Large Cities BFC, and I'm a systems transformation advisor. Karen, it's over to you.
Over here, my name is Garen. I'm a strategy lead on the Built for Zero Collaborative. I live in central Pennsylvania, and I'm excited to be here with you guys today.
Same. Hey, we're just gonna give a quick overview of what we're doing today, everyone. Today is Happy Wednesday, May 19th. Right now, you are attending the plenary session. Going to be talking about ending homelessness for single adults. Immediately after this session, we're going to give you a small break. We're going to come back and we're going to go into our cohort meetings. If you're unsure of where you should be, if you can reach out to your system, your IA, or you can always put it in the chat, and we'll make sure that you get to where you're supposed to be for your cohort meeting time. Immediately after our meetings together, we're going to come back together one more time at 3:30, and we're going to close out. We're going to have a closing plenary. So that is the width of our meetings for today. We are going to
if you just one note. I noticed that the times are wrong on these on this slide. That's my bad. The cohort meetings will start at 1:30. Yeah, they're 1:30 and they'll go till 4.
Thank you.
And then then the closing will start at 4:15, and we'll wrap up real quick.
Thank you, Garen. There is one more addition I would like to mention, and that's tomorrow. We are coming back tomorrow, guys. For those of you who want to join us again, we're going to have a couple of follow-up. We're going to be following up on ending homelessness for single adults. And we're also going to be having the second session from building the foundation. So we're going to be here tomorrow as well. Thanks, Garen.
Yep. Thanks, Candace. Before we dive in, 2 important orders of business. First, we missed a shift, and I wanted to shout out our friends at the Pikes Peak COC and just give our friends in Pikes Peak some love in the chat box. They also got a shift in the past 6 months, so let's celebrate them. Hooray, Pikes Peak! Sorry for missing you guys yesterday. Next slide. We want to do a quick swag check, and we have two swag friends today. Andrew from Sonoma County, if you're on, please come off mute and show us your swag.
Hey everybody, it's Andrew from Sonoma County. Hopefully you all can see me. So my interpretation of swag yesterday is just based upon what Garen mentioned, is just, anything which gives you confidence, which makes you feel fresh, and, a little bit of a way to show off. So, I'm going to show off a little bit this morning. So something which you all do not know about is I have my own personal fashion brand, and I've been doing that for about 2 years now with my business partner, and it's a new luxury clothing brand. And every time I put it on, I not only feel comfortable, but I feel confident, and I'm swagged out and fresh. So giving you guys a little glimpse, it's called Japelli brand. Yes, that is the name of the fashion brand. So you guys make sure you visit the site. So every time I have on my Japelli brand and I throw on I call it my stunner shades, we are working on our own line of sunglasses at Japelli brand. So this is just kind of like a prototype. And then I throw on my Japelli hat on top of that. You got to have the back strap out. It gives you a little bit more oomph in your style and your presentation. So whenever I have the sunglasses or the stunner shades, as well as the hat and the shirt, I'm fresh to death. I'm ready to take on the world. I'm ready to go, and I'm swagged out. So that is my swag.
Love it.
We've got one more swag, and from Urelli in Lake County. Thank you so much, Andrew. Urelli, come off mute and show us your swag, and then we'll dive in.
My swag is red lipstick, jean jacket, and cowgirl boots. Ready to start.
Awesome. Perfect.
Love
Perfect
it.
learning session outfit. I'm imagining everybody, like, I always like pick out my learning session outfits like weeks in advance. So I'm imagining this is like our virtual version of that. Cool. Well, thanks so much. Thanks so much for being a little silly with us. Now we'll dive into our regularly scheduled programming.
All right, hi everybody, I'm Nate French. I'm a portfolio lead for Built for Zero and Community Solutions. Beth and Eddie, do you want to introduce yourselves?
Sure. Hi, everyone. Beth Sandor, one of the co-directors of Built for Zero. Great to see you this morning.
Hi, everyone. I'm Eddie in Atlanta.
All right, so we're excited to have Richard Cho with us here today. Richard is a PhD and serves as a senior advisor for housing and services in the Office of the Secretary. In this role, Richard advises the Secretary on HUD's efforts to end homelessness, protect HUD-assisted households from COVID-19, advance the community integration of people with disabilities, connect housing with healthcare, and crest housing options for returning citizens. Richard brings to this role 2 decades of experience at the community, state, and federal levels, building collaboration between the housing, healthcare, social services, and criminal justice sectors to address the housing and service needs of vulnerable Americans. Richard, thanks for being here. Welcome.
Thank you so much, Nate. Can you all hear me okay?
Yep, we can hear and see you.
First of all, thank you for putting that photo up from like 20 years ago. That's like very flattering. Really great to be with all of you. Thank you for inviting me to what is probably the least governmental meeting I've been to like in my entire last 2 or 3 months here. Just love the swag stuff and the songs to dance to. I'll have to like run this by our ethics attorneys to make sure that I'm not officially endorsing any products here. But no, thank you for inviting me, and I love the energy here. I want to bring you greetings from Secretary Fudge. She is 100% in it to end homelessness, as you've probably heard in some of her press briefings. And I do want to just convey her regards to all of you, and really to just convey her thanks and appreciation for all the work that you do every day to try to end homelessness in America and bring more people into stable homes. I'll just share, some of you know, I worked in the Obama administration at the Interagency Council on Homelessness. Now I'm honored to be able to serve in the Biden-Harris administration as a senior advisor to Secretary Fudge. As Nate mentioned, my role is really to advise the Secretary on all the ways that we can move the needle on ending homelessness, as well as address the housing needs of other people where, in addition to housing, there's other vulnerabilities, health needs, and service needs that they have. I'll just share, just to provide a point of comparison to where things were in the Obama administration. We were working hard to end homelessness then. Many of you were working at the same time on ending homelessness in your communities. We were doing so at a time when there was no resources. In fact, I joined the Obama administration in 2013. Some of you remember a word called sequestration, right? We were told at that time, don't ask for more money. And by the way, expect to get 5% cuts across your budget. And so we were trying to end homelessness without any money, except for in the place of veterans homelessness. And so all the work that you've done, all the work that Community Solutions has done through Built for Zero shows how much you can make progress by being smart with the resources you have, and by working with urgency and a focus to end homelessness and bring more people into stable homes. And I think that's exactly what we need to continue doing. But I'm very pleased to be working now in an administration that is not only 100% committed to ending homelessness, to ensuring housing stability for all, and ending and reversing systemic racism in America. We're trying to do many things in this administration. And by the way, we now have significant resources to do so. And so it's a whole different ballgame. It's a whole different level of effort. I'm gonna say, I started February 1st in this role. I'm already pretty exhausted. I know many of you are exhausted too, right? We're trying to do a lot of things at one time. But I promise you, you have a friend in Washington and at HUD who is going to do everything we can to support all of your efforts on the ground, because this is a mission that we have to achieve. What I'll say is we're starting in a new federal administration at a time of coming through what is, the worst public health crisis and emergency in the last 100 years. And so much of that is what is both driving this administration to try to confront the challenges that COVID has unearthed. And that's not only about addressing the immediacy of the COVID crisis, but all of the things that COVID has surfaced, things that we've long known about, but that have brought to the fore, the extreme racial and ethnic disparities and access to healthcare and other resources. The way that the pandemic has taken people who are facing economic challenges, who before the pandemic were struggling with incomes, the extreme cost of housing, people who are on the streets and homeless. Again, our secretary likes to mention that, at the time when COVID arrived, when everybody was told to stay safe by staying home, there were more than 500,000 Americans on any given night who had no place to stay safe because they had no homes. And so what COVID has taught us is, we can't, not only, we have to respond to the immediacy of the public health crisis. We have to get our country to be in a place where people are not so vulnerable, where all it takes is a public health emergency for everything to fall apart, for people's access to housing, people's access to food, people's access to healthcare just falls apart. And so, when you hear President Biden and Vice President Harris and everybody in the administration talking about building back better, it is about that vision where we need to create a country where people are not so vulnerable and where we can give everybody the chance to have the security and safety so that when things are going to happen, emergencies are going to happen, it doesn't mean that the world has to fall apart. And so we're working on all those things. And I think we have a significant opportunity through the American Rescue Plan. And let me just say, things are hard right now. We're dealing with, many of you probably were working on the front lines. And by the way, before I came back to the federal government, I was working on the front lines in my own state of Connecticut, where we were doing everything to protect people experiencing homelessness, using hotels, trying to really fast track partnerships with community health centers to do symptom screening, ramping up testing. We became public health experts overnight. And we had to create some partnerships overnight. And that experience was both incredibly rewarding. I believe that we saved lives. I believe that all of you have saved lives. But I know that you're all a bit tired and it's been a really rough year. And I want to acknowledge that. But I want us to sort of think about how we now, even with all of that, and the fact that we've been juggling many, many different priorities and needs at the local level, we have this historic once-in-a-lifetime opportunity to make a huge dent in homelessness. And that we have to rise to that challenge because it's not only about helping the people who had to suffer the worst of the COVID crisis over the last year. It's also about the fact that this is our chance to demonstrate that all the things that we've been working towards, the belief in housing first as the approach that can help actually bend the curve on homelessness, achieve an end to homelessness, or in some places at least make a significant dent in homelessness. Like all of that is possible. We've been saying we're working as hard as we can without resources. We now have the resources, significant resources to move the needle on homelessness. We got to show that we can do that. And that's how we at the administration will be able to continue to fight for additional resources. So we got $5 billion in vouchers that we announced the week before last, 70,000 vouchers that have come to your communities. We've now heard from most housing authorities. About 40% of those vouchers have been accepted by housing authorities, but we got a long way to go. We have 5 more days for housing authorities to tell us if they're going to accept those vouchers. So if you haven't already talked to your housing authorities and said, hey, like, what about those vouchers that you were allocated? Please go do that. If you need to know who's accepted or not, like, let us know, because we want to make sure that housing authorities do accept these vouchers. And I'll be sympathetic to PHAs for a minute. Like they're working hard as well. They've had to deal with some major issues, but you know what? Like this is again a huge opportunity. And I'll say some of the big housing authorities around the country have already accepted, and some of them have said, and if you got more, we'll take more. Some of them have said, we'll take 5,000 more if you got them. So there's a lot of interest in it. We also have awarded $5 billion in homeless grants through the HOME program. And those funds are there to primarily help communities to create additional housing, because everything we're hearing about, again, 70,000 vouchers is a lot of vouchers at one point in time to use. And communities are saying, we're very excited. At the same time, where are we going to find the units? We're going to have to pound the pavement with landlords. This is going to be really challenging. And so we also know we can't keep fighting over the same units that turn over for low-income housing populations. We need to build more. We need more stock. Otherwise, we're only going to get so far with rental assistance alone. The $5 billion in home dollars that we've awarded to communities is really there to help us build more dedicated, affordable, and supportive housing for people experiencing homelessness. And so that's one of the things that we are looking at doing is how do we enlist the leadership of mayors, of governors, of county leaders to help us to really set local goals around how many people are you going to be housed with these vouchers, as well as rapid rehousing funds from the CARES Act, as well as how many new units of affordable and supportive housing we can create. And so more to come there. Let me quickly say, we got to work with speed and some urgency on how to use these resources to bend the curve on homelessness. In particular, think about the ways that COVID and racial equity factor into the ways that we're doing that. Again, when you think about how COVID has impacted the country, it disproportionately affected Black and Brown communities in the same way that homelessness had. I'll note that the estimates that 580,000 Americans have died of COVID, well, that's exactly the same number that at a point in time when that people were experiencing homelessness on January of 2020. So an identical number of people have died from COVID as were experiencing homelessness when COVID arrived on that night. And so if you think about that for a minute, it showed, and huge racial disparities in homelessness. So just kind of think about that for a moment, that who gets affected the worst when public health crises come or when housing costs rise? It's Black and Brown communities as people who are most vulnerable. And so we have to approach our work on ending homelessness with an eye towards racial and ethnic equity and disparities. And this administration, from day one, through President Biden's executive orders, through the work we're doing, where we've been charged to conduct assessments of what we're doing to advance equity across HUD, but all federal agencies, demonstrates that what COVID has taught us, that we can't solve our nation's challenges unless we do so in an equitable fashion. We're in the early stages at HUD of thinking through what that means, but I think what it does mean is to really charge us to think about how do we prioritize and assist the people who are most at risk of COVID, and also who have been most affected by disparities. Essentially what that means is how do you, where we want to get to is equality in outcomes. I'm sure some of you have had these debates at home. What's the difference between equity and equality? And so there's a set of people out there who say, oh, I don't think we need equity. I believe in equality, right? We're sort of missing the boat. We want equality in outcomes, but in order to do that, we need to acknowledge that we don't have equality in the baselines, right? People are not there, don't have the same level of access. And so what that means is we need to think about how to address homelessness and COVID vulnerability in a way that understands that people are in different places. And that what that means is that we need to be able to bring a different level of assistance to people based on what levels of need and challenges and barriers that they face. So I'm probably going a little bit long, Nate, so you can jump in anytime here. But I'll just say, we're committed to continue to fight for more resources, but at the same time to support all of you and the work that you're doing to put those resources to great work. And let me just, as a quick visual, just to close this out, I wanted to share one quick slide here, which is meant to really just demonstrate. One of the things that we've looked at is the comparing the trend lines on using the point in time count for homeless individuals, homeless families, and homeless veterans. And as you can see, and we also looked at on the top, how does the number of individuals, families, and veterans who are homeless compare with the number of dedicated resources that we have in rapid rehousing, permanent supportive housing, and other permanent housing for those populations. And you can see for veterans, the gray bar, which is the gap between need and resources, is not that big. And there's been dedicated resources in veterans. And you can see that reflected in the trend line. There's been a significant 50% decrease in veteran homelessness. Most of that happened between 2010 and 2016. I'll note that 2015 to 2016, which coincides with the mayor's challenge on veteran homelessness, which coincides with the work on Built for Zero, right? You see how that curve bent, a 17% decline in veteran homelessness in a single year. Over the last few years, that number's been flat. And what that shows is, you need resources to bend the curve on homelessness, but it's not resources alone, because we've had additional resources in veteran homelessness, but what we haven't had is the urgency and focus and the federal leadership over the last few years. For homeless families, that line has decreased. I'll note that the 2019 to 2020 point in time count was the first year in which family homelessness did not decline since 2012. And so you've seen that decrease. Much of that decrease was because of the work that communities did to shift away from transitional housing to rapid rehousing and other evidence-based practices. But we're now seeing a flattening of that progress. And we definitely know that we're maybe hit the wall in terms of how much we can shift from transitional housing to other programs. For individuals, the trend line was flat in early years. It's getting worse. It's getting worse for unsheltered populations. And you can see that in terms of the relative resource gap. Such a huge gap in dedicated resources for individuals. So now, again, $10 billion in a single year have been provided to the American Rescue Plan. We have a huge opportunity to address homelessness for individuals and families, but where you can see the acute need is among individuals and mostly around unsheltered people. And so we need to, I think, really take advantage of this opportunity to make a huge dent in single adult homelessness. So Nate, I will turn to you, and hopefully I didn't take up too much time.
No, that's great. I think where you ended is a nice segue into this first question. So you've been talking about this sort of unprecedented public investment in addressing poverty and homelessness, and we know that's happening at the federal level, but also at state levels and county and local levels, funding coming in from all these directions. And I think we're all fighting really hard to keep up with those resources and feel really committed to putting that new funding to work. And so my question is, 5 years from now, when we look back at this time, what do you think we will wish we had done more of or less of in this current moment?
Well, I hate to think that we'd look back on this moment and realize that there's something that we need to regret. And I think the way we can avoid that is by ensuring, I think like we in the homelessness field, right? So I'm taking off my federal hat for a moment, and I'm going to speak as somebody who's worked in homelessness for a long time. We've kind of learned to live with scarcity and with this idea that like we're never going to get more resources and we're never going to work hard. And I think we're trying to demonstrate that like why do we need to accept that status quo, and why do we also need to think that we need to kind of choose between populations and pit groups against one another, right? And so you have now an opportunity through the American Rescue Plan. I didn't even mention beyond the $10 billion that are dedicated to homelessness, there's $45 billion to provide rental assistance on an emergency basis for households that are facing housing loss because of COVID. There's more money for rural homelessness. There's more money for housing in tribal lands. We can do it all. And I think we need to shift from that false narrative that's been out there that somehow that our government and our country will never invest in the kind of things that are basic, that housing should be a human right and a basic human need, and that we need to meet that. And I think I will just also Nate, that it is like part of the reason why we've learned to live with scarcity is because we've always believed that the government's never going to invest in housing assistance. And part of what the backdrop for that are the kind of racist tropes and stereotypes, ideas like the welfare queen and things that have essentially tried to paint a picture that investments in social programs and in housing assistance contributes to this sort of like racist idea about dependency. And I think we need to change that narrative. And so I hope we look back on this time and realize that like this is our moment for not only making a case why we need to provide these resources, that housing is indeed a human right, and that if you give us these resources, we will see progress, and that we will see fewer people on the streets and in encampments and in shelters.
Yeah, great. So we're talking today a lot about single adult homelessness and the goal of ending single adult homelessness. And you've mentioned that this has been historically sort of under-resourced group. So how should we be thinking about resources when it comes to supporting single adults who are not designated as chronically homeless and aren't veterans? That group that's kind of the not chronic, not veteran group. What are the opportunities that we should all be paying attention to with HUD resources or other kinds of resources we should be thinking about for those groups?
I mean, I think there's something to be said about the fact that the $10 billion in the American Rescue Plan focused on homelessness are, not are provided in ways that is not through the traditional continuum of care program. We are, much of the work of homelessness has been through the way that we use COC funds. We need to realize that a lot of the answer for that is through vouchers and through things that the housing authorities can administer, both in partnership with the homeless system and COCs. Those resources, no chronic targeting for those, right? No specific targeting. The idea is we're allowing communities to make those decisions at the local level, PHAs and COCs using their coordinated entry systems and their existing efforts to try to target those resources. And so I think part of it is we need to broaden the frame. I think we've gotten far in prior years and administrations with targeted efforts on subpopulations. And we did that in many ways, believing that, again, part of it was a scarcity mindset, and part of it was the idea that if we could demonstrate progress for subpopulations, then we could demonstrate it for all. Well, I think we've done that. I think what we've done on chronic homelessness and what we've done on veteran homelessness definitely demonstrates that if you provide resources, you work with urgency, you connect people to housing, you troubleshoot those barriers, you can bend the curve on homelessness. I think that now is the time to say, like, let's apply it to all. We've said, we've proven that we can house anyone. Now the job is to house everyone. And that is what we need to do. And so I think, Nate, we got to broaden the frame, all single individuals, all families, and not to say like specific subpopulations, youth, veterans don't need special things. It's just more the idea that like we can't limit our efforts just to specific subpopulations.
Great. Well, Richard, we're at time. I wish we could continue, but any closing words you'd like to offer before you sign off?
No, I just keep doing what you're doing. Thank you for everything you do. Community Solutions, Built for Zero. Thank you for the work you do, the energy that you bring to this work, the enthusiasm for this work. It is what all of us need, right, to keep us going in what is hard work. But I hope you all realize help is here, and we're going to continue to be your friend to assist in any way that we can. So just thank you for all that you do, and again, keep up the great work.
All right. Thank you, Richard. Thanks for being here. Thanks for your commitment. Like I mentioned earlier, we're glad you're in this role. You've been with us in this journey for a long time. So thanks for all that you're doing. All right. I think at this point, I'm going to hand it to Eddie.
Cool. Thank you, Nate. Thanks, Richard. I would like to introduce two of our community leaders. The first is Mary Simons. Mary Simons leads the coalition in Gulf Coast and Gulfport, Mississippi. If you didn't know, but I bet you did, they were one of the very first coalitions in the country to end veteran homelessness right since the start of all of our work together in Built for Zero. They've consistently been at the vanguard, and they are at the vanguard today, because as soon as there is a definition for what is required to end homelessness for single adults, those folks from Gulf Coast are going to be right there at it. So Mary and her team have done a lot of work. And I think it's a moment for us to all learn from what they're doing and what they're figuring out. And Abby Dunner is the incredible, insightful leader from Fairfax County, Virginia. Their team has been working on the entire system for all adults. And they're starting to ramp up their improvement work, and they're taking on a couple of projects to intensify their work to end homelessness for single adults. So actually, we can turn off the slides for this part, and we're going to talk with Mary and Abby for a minute and figure out what they're doing. Can we spotlight their videos too?
We could not spotlight, and that would be fine.
And Abby Dunner. Yeah, perfect. Do we have you both? Oh, okay, working on it, good. Abby, I see your video first. How are you today?
I'm great. I was saying if you don't want a spotlight, that's okay too. I can be just in the nice mix of all the
No, the spotlight's
places.
here. You gotta live with it. And there's Mary, perfect. Mary, how are you today?
Doing well. How about you?
I'm good. I'm excited to be here. Maybe the first thing, talk to us about, so we all know that in Built for Zero world, all of our improvement work for ending chronic homelessness and ending veteran homelessness is very developed. We've got lots of playbooks and ideas and strategies for all of that. Will you each give us just a little glimpse? How developed is your strategy for ending homelessness for all adults? How much system do you have built up for that expanded population so far? Mary, let's start with you.
So we have broadened out the strategies that we used in ending chronic homelessness. Obviously, in ending chronic homelessness, we use some of the same strategies as ending veteran homelessness, but with different partners, different funding sources. Ending chronic is really just the beginning for us in ending unsheltered homelessness. And for us, the unsheltered population is made up primarily of single adults. There are single adults in other systems like transitional housing for persons who are fleeing domestic violence or transitional housing for reentry. But other than that, once we end unsheltered homelessness, we will effectively end homelessness among single adults. We have not had a family with children unsheltered in our point in time count for the last 4 years now, because we have developed the systems to be able to handle that. But really, in ending unsheltered homelessness, ending homelessness for single adults, it is an expansion of what we've done in ending chronic homelessness, but also developing new partners to include those mainstream resources so that they're not a checkbox on that continuum of care application, but rather really good and developed partnerships with the Housing Authority for the mainstream vouchers, the upcoming emergency vouchers, developing partnerships with our state agency and the Department of Mental Health in accessing a new funding source for us, which is the choice vouchers, which are a state-funded housing and services voucher. That would serve people with mental illness. Not every single adult has mental illness, but it certainly makes a dent. So as we piece all these different puzzle pieces together, we're able to put together the partnerships and the resources for ending homelessness among single adults.
Love it. Thanks. It's an expanding. You're adding new partners. You're taking the stuff you're already good at, and you just keep like stretching it out. That's awesome. Thanks. Abby, what about you? How formed is the strategy in Fairfax? How much system is already built up to get to that goal?
Yeah, so we obviously, so I work for what's called the Office to Prevent and End Homelessness in Fairfax County, which is a division of our Department of Housing and Community Development, which is also our public housing authority. And so OPH has been, and our COC, our Fairfax COC has been working on kind of all singles for many, many years. But this is kind of the start of our kind of work on all singles through kind of the BFZ lens. And so we started reporting on all singles data to Built for Zero because we have the capacity to do that within our HMIS and our amazing data lead, Stephanie, which is really great. So that shows a level of capacity of just having the data available. And we've also had for quite a while now a by name list process for all of our outreach programs so that anybody who's unsheltered is on some sort of by name list, as well as all of our shelter programs, to include our 400 plus room COVID response hotel program. So we have by name list meetings for all of those programs regularly, and actually our unsheltered outreach folks were the first by name list meetings that we started in Fairfax back in kind of 2016. We didn't have a whole lot of kind of targeted by name list meetings, and we decided to start with outreach because those were often the ones, our unsheltered folks were often the ones that weren't getting talked about because they weren't in mainstream shelter programs. They weren't, you know, there wasn't this push of like, we need beds turned over. There's all this funding attached to shelter. And so we started with outreach for that purpose, and it's just grown since then, which is really great. And also, as thanks to Built for Zero, we're launching a diversion program through the partnership with Kaiser Permanente to kind of sit at the front door of our emergency shelter program for, emergency shelter coordinated entry system for single adults, because we recognize that, you know, while we can do everything possible to, you know, outflow folks and to house people, if we can't do anything to stem inflow, we're just going to kind of keep treading water and we're never going to get there. We did some evaluation of our, you know, coordinated entry data when it comes to shelter and saw how many folks were calling for shelter who were not yet homeless yet. So calling from friends and family or a hotel or some sort of institution. And we really had no resources dedicated to serve that population. And those were folks that eventually inflowed into our system in some way. And so now we're really excited to have a targeted program that's going to really work to stem that inflow at the front door with really targeted diversion services. So we are working on it. We have a long ways to go in Fairfax, but I think there's a lot of energy around, especially the diversion program, and really just trying to strengthen our by name list processes. And so we're ready to go.
Yeah, I'm so glad you called attention to that. I think that we all know conceptually that it's not enough to increase your outflow. You've also got to decrease your inflow. And if you can do both in one fluid motion, then you're really going to get somewhere. And that has never been more crucial than it is looking at this expanded population of all single adults. So that's one difference that you've just pointed to, Abby, about what's different in this goal of ending homelessness for all adults, as opposed to just the chronic and the veteran work that so many of us in Built for Zero world have really focused deeply on. What's another difference? What's another difference that occurs to you that's just really clear between ending chronic and veteran homelessness and chasing after that goal and chasing after the goal of ending all homelessness for all adults? Abby, is there another one that kind of pops up for you besides the focus on inflow?
I mean, the first thing that really jumps to my mind is just kind of sheer volume. And I think that, when you look at something like all singles in large localities, I mean, we're a suburb of DC and, serve kind of an annual count of about 3,000 people over the course of a year. So we're not by any means like a DC or a New York or an LA, but we have a sizable population for a wealthy suburb of Virginia. And so really when, especially I think on the provider side, when they're looking at, they think about ending homelessness for all singles, you're just looking at such a large group of people. And when you look at subpopulations, you're inherently narrowing your scope. So I think it's figuring out within that larger lens, we still can't staff every single person in every single meeting because there's just too many. So we still need to figure out ways to break it down. And I know your question is about differences, but I actually find there to be a lot more similarities between kind of the work for all singles and the work for chronic and veterans. And, I think especially now amidst COVID response, for example, the amount of rapid rehousing dollars that's come through has just, to say surpassed what we typically receive in funding doesn't even cover, it's an understatement. We received 5-6 times more rapid rehousing dollars. And those are dollars that are designated for all people experiencing homelessness. So it used to be that there was, very specific resources for these subpopulations, which is why we focused on them. But the resources and now with the emergency housing vouchers and the other assistance that's coming out of the government, Richard spoke to a lot of it. This is a time where there's the ability to see so much similarity between how we work on chronic and veteran issues and how we can work on an all singles list. I'll mention too, just as far as more similarities than we think, there's the same kind of challenges. It's also, how do we keep people housed? How do we provide these wraparound services for people, chronic or not? A lot of our folks who are kind of considered all singles but don't fall into our chronic category may as well be chronic with the disability piece or with the ability to stay stable on their own and need just as much support in housing as somebody who would be in permanent supportive housing. So how do we do that? And what kind of services, how do we wrap services around people? So I know the question was about differences, but I really think there are so many similarities to how we can approach this work with all singles.
Love it. Love it. Mary, tell us, what's the next big thing you've got to figure out? You all have made a lot of progress. What's the next thing you're looking to figure out in this space?
Well, before I get to that, I noticed in the chat that someone had a question about rapid rehousing and how rapid rehousing studies have shown it to be most appropriate for families and about using it for single adults. We use rapid rehousing a lot for single adults. We also used it to address chronic homelessness and learned a lot of lessons. And what we found is that rapid rehousing is a brilliant tool because, one, it is a place where we can provide subsidy as it is a bridge to something else. So it is a bridge to a more permanent voucher if that's needed while the person is on that waiting list, or it's a bridge to those very scarce openings in permanent supportive housing. Or it may be that time frame that someone needs to decide to be in recovery, to decide that making changes in their life are what they want to do now. And so they're able to not only be in recovery, but now get a job. And in many cases, get very, very good jobs, making more than the case managers and doing very well and being able to close the door to homelessness forever. And so that rapid rehousing opportunity allowed us to do that. We can't decide on the front end who's going to be successful and who's not. I learned that a long, long time ago. But by giving everyone the opportunity for that subsidy, we have found that about 40% of the people that we're serving in single adults in rapid rehousing will need some sort of longer term voucher. Sometimes that's a voucher with the Housing Authority. Sometimes that is even reconnecting with family in a different way. So they're not alone in an apartment paying rent, but they're now reconnected to family. Another 30 to 40% are ending their tenure in rapid rehousing and rental by client with a full-time job of some sort. And then the other 20% are finding other kinds of opportunities. So it's been really exciting to experiment with rapid rehousing with adults in the chronic space, and then broadening that out for single adults. It has really been a game changer. And with all of the extra resources now, those bridges are incredibly important. If we just look at it as a time limited piece of housing and then what next, I think we're doing it wrong. If we're providing the case management that's needed, if we're providing the linkages to services that people want, then it is that bridge to the next step. And so the next big thing for us, as we tackle ending unsheltered homelessness, which for us, we were one of those that the point in time count data said, are you sure your number is right? Because it's 5 times more than the sheltered single adults. And unfortunately, yes. However, we've gone from 800 unsheltered people in 2007 down to about 200 in 2014. And then we just kind of stayed there, kind of stagnant. But fortunately, in the last 2 years, we've gone from that 200 down to 144. And we're, with all of this acceleration in movement, in activity, and in resources, we will get to a functional zero for single adults. When we do, the next big thing is looking at our domestic violence system. We have a very, very good set of providers in domestic violence service provision, to include safety, housing, legal assistance, and other things. And we know that we cannot cookie cutter the strategies that we have for ending homelessness among single adults into the domestic violence world, because the set of needs are different. And so we want to tackle together in the homeless services sector and the domestic violence sector to figure out how we can work together to shorten those times in shelter and transitional housing in a safe way, but also tackle the bigger systems in law enforcement, in the court system, in other places, to make fleeing domestic violence less dangerous than it is right now in my state and some of our neighboring states.
Yeah, that's awesome. I have to make that the last word, but no, that's awesome. That was incredible. And I'm going to put in a plug. I saw the chat popping off about using rapid rehousing with your chronic by name list. Let me just tell you, we're going to talk about cohorts at the end of this plenary. That's a thing that we're going to pick up in a lot of our cohorts. And so like, if your ears perked up at that, let's figure out how to do that together. We think you've got to do it if you're going to end chronic homelessness in a lot of your counties, not in every COC, but in a lot of COCs. So, you know, that one got a lot of reaction. Mary, Abby, thank you so much for talking with us. Thank you for the work you're doing in your local communities. And we will see you a little bit later. Thanks.
Thank you.
And I will hand it off to Beth.
Thank you so much. That was incredible. I'm going to actually share my own screens. I'm going to switch to that real quick. And just like, what an incredible morning so far. And for those of you who were, you know, lucky enough to join us yesterday morning, my colleague, Jake McGuire, did an incredible job taking us back through the journey of this movement and the journey of this work together. And he talked about a lot of inflection points. And one of the really important inflection points in our work together was the launching of Zero 2016, which, as many of you know, was the first name for what is now Built for Zero. And I was able to last night pull slides from a presentation we would use to recruit communities into Zero 2016 back in the fall of 2014. And in this presentation, we were really clear on our goal. Our goal was that all communities in Zero 2016, of which there ended up being 75 at the beginning, will end veteran homelessness no later than December 31st, 2015. And all communities will end chronic homelessness for individuals no later than 12/31/16. We were very ambitious in these goals and very naive at the time, which I think was a blessing, to be honest. But we were collectively quickly humbled by the scope and the complexity of the problem that we were trying to solve. But one thing was true, which is that we were undaunted by that. And here we are today with 89 communities committed to ending veteran and chronic homelessness, half of those communities making reductions, almost all having quality data for one or more populations, 14 ending for veterans and chronic. And in the conversations you've heard in the last 2 days, just such incredible problem solving constantly among all the leaders on the ground in these communities. You know, our original vision, our original theory of change for this work, when you go back to 2014, was starting with veterans and chronic and then scaling out to all populations. And to be honest, it was very hard sometimes to acknowledge that that's where we wanted to go and that that was our theory, especially in the first 3 years of the work when we were doing a lot of failing forward and it was so hard to even get to initial proof of concept that we could, you know, collectively do it for veterans or chronic. But what made the progress that we have seen so far possible has been the persistence, the resilience, the bright spot from communities, the encouragement of each other, the encouragement from funders and from friends, a deep sense, I think, among all of us that no one else was coming. If it wasn't us, then who was coming? If we didn't do it now, then when were we going to do it? And a moral imperative that homelessness is a public health crisis, that racism is a public health crisis. And I think we are at another and really important inflection point in this work. The last 5 years has demonstrated what is possible and inspired new levels, unprecedented levels of investment and confidence in what's possible. And so we want to fully lean into this moment with all of you and leverage the momentum, the knowledge, the don't stop me now spirit that we've been talking about to commit to national proof points on ending all single adult homelessness and seeing that as a natural continuation of the work we have all started together, that everyone has articulated so clearly already. And so we want to message, we want to operationalize ending veteran and chronic homelessness on the path to ending all single adult homelessness, which is on the path to ending all homelessness. And many of you are also working on ending youth and family homelessness, which is so critical as well. So We are not naive, as naive as we were maybe back in 2014 for how hard this road is going to be and how tough it is. And given my experience now as a leader of a large scale change movement, I did a risk analysis and thought, okay, what are the challenges we might face as we take this on? And three things occurred. One is that we don't know how to do it, that the problems we're going to be facing are different than the challenges we faced so far. The population is a lot bigger, as we've talked about. We don't have the resources to do it. You know, there's an affordable housing crisis, there's an impending eviction crisis, and while there are a lot of resources brought to bear, that maybe there's just not enough. And that no one has ever done it before, that there's no proof yet that it's possible. And so while I was thinking about these challenges, I was also thinking about how to mitigate these risks. And one image came to my mind. And that was an image of all of you, not just of the team in Chattanooga, Tennessee, but of all of you. And I think all those challenges that I laid out are also the challenges we have faced together over the last 5 years. And the thing that we have is each other, is this movement of communities, is this cadre of local, state, national partners in both the public sector and the private sector who are committed to figuring this out, who believe that if anyone is going to figure it out, it's going to be this group of communities and leaders, and who are putting a collective bet on that in the same way that we are. The investment from MacArthur, the investment that we're seeing at the federal level, the investment that you are making at the local level in your communities is more than about money. And I think this is really important. It is a manifestation of the collective will that exists and is waiting for us to seize and catalyze us to move beyond incremental change to radical change in the next 5 years. And while the challenges, I think, are big, the opportunities are even more enormous. That we have an opportunity to fundamentally change the lives of people experiencing material poverty in the US, and to work upstream with other system players and address inflow in the ways that a lot of people have already talked about. That we have the ability to tackle the most visible homelessness in our communities. I am sure that many of you have had questions from people in your community. When you end veteran and chronic homelessness, will I still see people who are experiencing homelessness? And the answer is always yes. But this population allows us to make visible change in communities and really increase the believability that it is possible. We have an opportunity to confront systemic racism at a different scale. Operationalizing across all populations really allows us to address the racism that exists within the homeless response system and in upstream systems. A proof point on all single adults will mobilize and sustain political will we'll need to end for all populations. And in the doing, as we've seen in the past, we can create a roadmap for other communities. None of this work is just about the 89 communities in Built for Zero. It is about changing what is possible and what is expected at a national level. And in the doing, we get to continue to build this community of joyful problem solvers, which has been one of the most amazing experiences of my life, is to do this work and have fun while we're doing it with all of you. So this is our commitment to you to leverage our resources, our brain power, our partnership to really lean in to ending all single adult homelessness in your communities and in this country. And here are the actions you can take as a leader in this movement. First is to establish the commitment in your community to ending all single adult homelessness on the path to ending for all populations, no matter where you are. If you're working on veterans, if you're working on chronic, if you've already ended for both and you're working on scaling, we need to start to really own and commit to that across our communities. You can continue to be an evangelist for ending homelessness at a population level. We still have a belief barrier we have to break down in this community. And so sharing the stories you've heard at the learning session from other communities, sharing your own story of what is possible will allow us to bring the partners into the space that we need to really drive the reductions in homelessness nationally. Continue to put racial equity at the center of this work. Our communities, there's no equitable future for our communities unless we end homelessness. So really focusing on that and building our strength as a movement around racial equity. Engage your electeds, your mayors, your county executives, your governors, your Congress people. Make sure they know you are part of this movement and know what you are doing so that they can advocate for the right resources that you need, the policy change you need, the collective will we need to take this movement over the tipping point. And continue to support and champion the other communities in this movement. It is part of our theory of change that doing this together will accelerate the learning and also make sure we all don't burn out in the process. So really get to know each other and take the time to tell each other stories and support each other along the way. Eddie is going to tell you about how this is going to look different in Built for Zero and on the ground in your communities and in our support to you. And before I hand it over to him, I just want to thank all of you for being in this. You know, this is the work of my life. This isn't just a job. And it has been an incredible journey. And I can't wait to see where we are in 5 years and what we all have achieved together. So enjoy your last day at the learning session. Eddie, I'll hand it back to you.
Thanks, Beth. What a stacked plenary. Oh my gosh, so many great people in plenary this morning. I am going to share my screen one final time and tell you about a couple of things that you can do with Built for Zero to get started moving in this direction with us. There's the slide. The first one is you can start adding single adult data to your monthly Built for Zero data submissions. Abby from Fairfax, who was just with us, that is one of the first things that her team did to start their improvement work with Built for Zero, is they added in all singles to their monthly data submission. It gives us a way to start to track opportunities and progress with you. We'll figure out what to do with it as we go more and more and more. Tomorrow, at noon, there's a session, especially if your hands are on the data, if you're pulling reports, if you're figuring out how to optimize reporting and analyze it. There's a session called Going Deeper on All Singles Data. Join that session tomorrow. They will help you figure out how to really get your hands around this data in the improvement space here with us in Built for Zero. And then by the end of the year, we're going to be ramping up more and more and more coaching support for ending all singles homelessness. So that's what the work ahead looks like. There is one more stacked plenary speaker in this good deck today. I am about to invite Nanion Lewis from Institute for Healthcare Improvement. Nanion taught us what a collaborative was. We didn't even know what the word meant until Nanion came and taught us. And she's our friend and consultant. I think she's spoken at every single learning session. This one will be no different. Nanion, are you on with us this morning? Okay, wait, let's give it a second.
She says she's here, but she can't unmute. Come on.
Sean, will you get it? Her in the chat there.
Okay, I'm here.
Perfect.
Hello,
Yay.
good
Excellent.
to see all of you guys again.
Yeah. Nanion, how are you this morning?
I'm great. I'm Nanion. I'm vice president at IHI. I use the she series pronouns, and I live and work in Cambridge, Massachusetts, on the indigenous lands of the Pawtucket and Massachusetts people. So I want to honor that. Great to be back with you guys.
Thank you. Thank you. Excellent. Nanion works in that's right. Nanion got a dog. I asked what should we like share with folks to update them about what you're doing that's not work related. Nanion got a dog during quarantine times. Lou, how did you come to the name Lou?
Lou is named after a character in one of my favorite songs from one of my favorite bands, which happens to be interestingly a very sad song, but it feels apropos because, as you can see from the picture, she has like a resting sad face, if you will. She just kind of looks sad all the time, but really she's content. So she's Chief's news officer.
That's incredible. She's very young to have made the sea level. That's congrats to Lou. So what Nanion and I are going to be talking just for about 12 or 15 minutes here at the end of this plenary about cohorts. Some of you are in large cities cohort or Zero for All or healthcare. This may apply to you less, and you're welcome to step out, but you may also find it interesting. So you're welcome to stick with us if you want, because you're already in a cohort. But for the whole community of communities here, a lot of you are going into cohorts in just a few minutes. And Nanion and I wanted to take a minute to think together about what's to come in these cohorts and how can they really benefit you and your community. And I'll tell you the starting place for thinking about this is the question that's been on a lot of your minds lately. You ask us on calls, we get it in emails, we see you talking about it on the Facebook Homeless Hub. What comes after the VS for that, right? We're concerned about, are there equity problems with it? Are there just effectiveness problems with it? What comes after the VS for that? And I'm going to tell you just my personal take is that if your answer concerns a tool or a form, I think you might be playing the wrong game. I think you might be playing the wrong game, because I think there's something bigger and deeper and more expansive than just that form or that tool, right? Like, you're putting your finger on something that's about matching, that's about assessment, that's about the core of how the coordinated entry system works. Isn't there something that might work not just a little bit better about that system, but a lot better? I think you feel it too. I think you're sensing it too, that there's a better way to do coordinated entry, and it feels like it's just around the corner from where we all are together. All this look back that Beth just did with us, that Jake did with us yesterday, it's pointing us in that direction, right? That we've made all this progress. We've built on so much learning. We're housing people faster than we've ever housed people before across the country. And I think so many of us have the sense that there is a much, much better way to do this. And I think what stands in the way sometimes is that as a movement, we grow accustomed to incremental improvements, right? The 10% improvement, the 12% reduction. I think we've grown accustomed to plans not turning out as we hoped. A year ago, I remember talking on the phone. I was driving back from Boston to Atlanta in May last year. Everyone's quarantined. And Brenda from Lake County, Illinois called me, and she said, we're getting all this rapid rehousing dollars. We've got more rapid rehousing capacity than we've ever dreamed of. I think that we can wipe out our entire by name list with it. And so many of you around the country were saying that, right? We all had that same idea. And then like, we haven't figured out how to make it happen yet, right? We see it, but we haven't figured out how to make it happen yet. And I think a lot of us have just gotten used to the idea that our social services in the United States just can't work that much better than they do, right? We get inured to trying to make it better. And we are all convinced as a movement, what sets this network of folks apart is that we believe that better solutions await us. And so Built for Zero is evolving to, let me tell you about a very specific way. For years and years and years, we deployed coaches to work with your teams one-on-one to help you build by name lists. When new communities came into Built for Zero, you got assigned a coach and we went to work on the scorecard. I was one of those by name list coaches for years, right? And recently we ran a test. We said, what if we invite new communities to join a cohort led by a group of coaches? So 6 months ago, 7 communities joined a cohort that we call ISS. They had 3 coaches, and here's what's happening. We are closing in on a 714% increase in communities who can achieve quality data within 6 months. I bet those of you who were in this first ISS cohort did not realize that you were being experimented on in this way, but it was a really new thing, and look what it's done. Actually, there are communities who got to quality data this week who didn't make it on the slide, but they're going to be on the next slide of the next learning session. The thing that we're convinced of is that there's power in a cohort, just what Beth said to us minutes ago, that you've got to go together, right? There's power in a cohort, and so we are launching 4 cohorts this week. Let me give you a quick glimpse of life in a cohort. A big piece of it is that they are highly structured, they're highly organized. It's not about adding new work to your plate. It's about giving you containers to take all the work that you already think is important, that is already high up your priority list, and just giving it new shape so that you can get more out of it. We want you to access a team of coaches, not just the one coach that you happen to be assigned to, because every person is good at different things, has different experiences to contribute. So we're going to get you access to a whole team of coaches so you get the best of Built for Zero at every point in your relationship with us. We've got lots of resources and ideas packaged, ready to go, so that you've got a clean starting place in all these cohorts. We're going to tell you lots more about them later. I've got to say that the key part here is you're going to get results. You're going to get results. We're running a case conferencing cohort right now. We're in the 3rd month of it. Communities are increasing their housing placement rates literally faster than me and Emma can keep up with. We can't even record all the data because your housing placements are increasing so fast working in this cohort shape. So I feel really excited for more of you to come into these cohorts. But there's one more thing about a cohort that a Subaru in my neighborhood that I walked past the other day told me: you get to do it together. I think the really fun part of the cohort is that it's not just you laboring like some like intense college course, trying to do your homework and figure out what comes next. The cool part about the cohort, the part that makes it sustainable and energizing, is that you're doing it with other people who are doing the work too. So Nanion, you know all about cohorts. You all have run so many cohorts. Tell us what you see. Tell us a little bit more about how a cohort works.
Yes. So let's go to the next slide. The basis, the nucleus of the cohort work in a collaborative is the model for improvement. I feel like the model for improvement is my jazz hands, right? And it's suddenly become all the coaches' jazz hands. And it will, for many people who've been in the collaborative for a long time, it's kind of become your jazz hands too. Ultimately, for those that might be new to the model for improvement, this is a simple model for learning and change that drives pretty much all of the work in the collaborative. And it comes down to 3 questions and what we call a testing cycle. So on the left in the 3 colored boxes is the thinking part. The 3 questions we ask to set the direction for this work. First, what are we actually trying to accomplish? What do we want to do here? Whose lives got better because we're here? That's the aim. Then how will we know that it changes the improvement? That's a clue to measures. But isn't it wonderful that we don't have measurement in that question? Because it's simple. It's how will we know that a change that we made, it leads to actual improvement. And for us, it's not just process improvement, it is population level reductions in homelessness, okay? And then finally, then given those 2 things, what change can we make that will result in improvement? What are the changes? What are the interventions we can test? And then let's get to the doing part, which is that plan, do, study, act cycle. And that allows us to iteratively test our way at a small scale, building our confidence in the changes that we're putting in place so that we can make it a part of the way we do business in our community. We change the way that we do business, okay? How does it actually look like in practice? And you can click all the way through, Eddie. It means that we're identifying breakthrough aims that make sense for your community in that particular cohort that you're in. So the cohorts are designed to meet you exactly where you're at, whether you are like, I got my by name list, I'm ready to rock and roll, I want to move to my first shift, I want that t-shirt at the next learning session. Then in Shift Lab, you're going to be working on that aim, okay? You might be also choosing and tracking the right process measures that will drive reduction. And for this, you're going to actually be able to step right into that at day 1, where there's measures that you can snap right into your by name list. And then we're going to also work on developing a portfolio of diversified things that you're going to be trying. Some of which are going to be from a theory of change that you're able to customize from the smarts that we've built through these years of work, where we have a kind of a medium to high degree of belief that if you do these things, it will result in improvement. You'll be able to take that theory of change, customize it to you, and choose a set of improvement projects, interventions that are going to work for you. So this model both works for the whole design of the cohort, as well as the individual pieces of work you're going to do within your community. We can go to the next slide. So did you know that the first ever learning collaborative with a capital C that Built for Zero Collaborative was based off of was in 1995. So we're pushing 30 years of experience here. And there are in a whole variety of sectors, from industry to healthcare to education to housing, other social services, there's probably thousands of collaboratives that have now been run. Under IHI's Built alone, we have probably 500 that we've run. In my time, in the 12 years that I've been at IHI, I have almost 20 that I've been working with. Built for Zero is just one of the 20. Sometimes I feel like I'm a seconded employee to Built for Zero, but I actually work for IHI and I work on other collaboratives too. So let me tell you a few different things that we have learned and I'm going to be unapologetic about. The first is those who pull the collaborative towards them get results, okay? When you feel like you need something from the collaborative, you're on the phone with the coach. You are taking that to your peers in the cohort coaching calls. You are sharing your learning at the learning session. You're pulling all the juice that you can from the collaborative and pulling it right towards you. Those are the folks that get results. Who else gets results? Those that let go of the belief, and this is a tough one to swallow. You can let go of the belief that you are terminally unique. What does that mean? You constantly feel like my experience is not like anybody else's. I can't learn from others. They can't learn from me. This is tough, and this is tough only for me. You have to let go of that. I can say that because I'm just outside of the collaborative enough to just kind of provocatively say, you're going to have to let go of that belief. And once somebody lets go of that belief, they get results. Those that authentically get to know the aims and the work of their peers get results. I know folks who are in collaboratives that shut down several years ago, and they still travel across the country to attend each other's babies' christenings because they know the aims and the work, and I'm not even exaggerating here. They know the aims and the work of the peers because they know that if we do this together, it will accelerate my own ability to get results, and my success is bound to yours because this is all of our population that we're trying to reach, okay? Additionally, those that embrace the mentality that the only way out is through, people, those get results. And so when the going gets tough, if you're saying this is hard, and I actually, because it's hard, I'm going to get on the BFC calls, those are the ones that get results versus the ones that say this is hard, and so I'm not going to join the calls because I don't have time. Okay, so lean into that the only way out is through, and knowing that if everybody's also embracing that mentality, that's when you start to see the real magic happen. As we've gone through the last few months of very intentional design of what the cohorts can look like, we've designed a learning pathway to results that every single cohort have all kind of embraced this. We have some measures in the back end to make sure that we're meeting the needs of all of you guys in the cohort so that we can move and pivot based upon what we're learning over time. And it comes down to 4 things. It starts with the experience, that if we can create these safe and joyful spaces for learning and innovation, we can actually learn some things and begin to test. Okay, so these experiences, making it fun and having a slogan and t-shirts, that is not just fun for fun's sake. That's like designed into the experience to create a safe and authentic space for you to learn stuff. Okay, so then it's only good as if you're actually learning, and it's only the learning as if you put it into action. So seeing the process changes. How are you working differently? How are you seeing changes in your process and your practice? And then the outcome change. How is that all rolling up to population level reduction? So we've got a theory of change behind this. Of all the cohorts, not just what kind of things do we want to do this month. It's like, no, what is our theory of change that it actually meets you where you're at and gets you to where you need to go? Go to the next slide. So that's how we've designed it. But this is a two-way street, right? In a cohort, there's power in a cohort, and that means that the Built for Zero team has set up some things. And here's how you, as communities, will meet the Built for Zero team where you're at to get to the results that you want to get to. And that's a set of touchstones that I've pulled from other collaboratives that I think could be helpful to this. So there's 6 of them. 1, trust that we all hold a piece of the puzzle and we need each other's pieces to understand the whole picture. The Built for Zero coaches are only one piece of the expertise you're going to draw upon because you have the lived professional and academic experience of your peers in your virtual room right now. Okay, so everyone has a piece of the puzzle. And that means that you need to embrace those differences, be open, and honor each other's learning and resourcefulness. This is one thing in a learning session. Emma Beers, when she was still at Chattanooga, before she was a BFC coach, she said something that was one of those moments of like, once you know it, you can't unknow it. She said, when I work with clients, I know that maybe I can't always offer them my resources, but I can always offer them my resourcefulness. Emma, you have no idea how much I have quoted that ever since. And I feel like that's the way that we can be thinking about in this cohort, that we can't always offer each other resources, but we can always offer each other our resourcefulness. So how can we honor that with one another? Additionally, when the going gets rough, suspend your judgment and get curious. Okay, this is the only way out is through. Like, isn't this interesting that I keep hitting this wall? I want to bring this to my peers. I want to bring this to my coaches. Accepting that we'll sometimes fail, that we're going to learn together, we will move forward. If we make a wrong turn, or if something in the cohort isn't designed to meet you where you're at, we will pivot and we will turn that way together. Okay, we've put something on paper that we think will get to results, and we are unapologetic about those design principles and those values, but we are flexible in our approach. Okay, so we will go and we will turn that way together. And the only way that that can happen is if you take and share responsibility for the learning in the room. So this isn't like you're now a customer of the collaborative, and if the BFC coaches aren't getting it right, then okay. No, actually, I have responsibility for this. And so I'm going to help shape and co-design how this is going to help me get results. Being able to balance the yearning for change. This is a really important one. Balance the yearning for change and wanting to get those results quickly with the patience for the process of change and growth. This is something that at Community Solutions, we're constantly holding that tension and trying to hold it in a life-giving way of we got to get results. The time is now. And this is a process to build this capability and this readiness over time to be able to transform for the long haul, not just meet a goal we have in 100 days or in 2 years. And finally, and I think the most important, make the way we work together an example of what's possible. Make the way we work together an example of what's possible. When Eddie said there's a 714% increase in communities that can get to quality by nameless data in 6 months, that is an example of what's possible. So I think that there is a possibility to make the way you work together in each of these cohorts an example of what's possible. And that's what we're here to do. We're here to get to help people believe that there is an end to homelessness that is achievable, that we hit a tipping point in the whole country, and that we are catalyzing this movement. And so it's kind of up to us in the room here to get to work, and let's see what happens in the cohorts. Again, we are unapologetic about the way that we've designed this in terms of the principles and the values, and we're flexible in the approach. Eddie, to get back to you.
Love it. Thank you. Thank you, Nanion. Thank you for helping us prepare these cohorts. So in just a minute, we're going to talk cohort logistics and wait lists. Don't stress out, I promise. We're going to figure it out in just a second. But real quick, just to land this plane, we just want you to remember, we know that there's power in a cohort. This is a learning space. It's a growth space. It's a break from your all accountability, all the time spaces that you're in. And we really hope that you will cherish that and that you will use it as such. And I gotta say, it's not a training. A cohort's not a training. It's not a webinar. It's not the Built for Zero show. It's something that you've got to come own with us. It's practice. Take action with us in these cohorts. Together in these cohorts, it's the shape in which we can figure out together the thing that comes after the VI SPDAT. This is the laboratory where we can all create that together. We can realize some really big ambitions. And if you commit to the process in this cohort, we are positive of it, you're going to see outcomes. You're going to see your actively homeless numbers come down. We're going to see that tidal wave come. The thing that made me think about is, how we keep saying they're not my client, it's our clients. We've been saying that in the case conferencing stuff. It's not my client, it's our clients. It's not just about your outcomes either, right? You're going to see outcomes, but what's different about cohorts is that it's not my result, they're our results, right? And we're going to be able to say it's not my system change, there are system changes, there are transformed coalitions, there are communities that ended homelessness. We're going to get there together. So here's where we're getting to together right now in just a few minutes. Here are the communities that we have registered for these cohorts. Most likely, if you were registered, you received an email from me yesterday afternoon with that link, just so that there would be less confusion about what's in Sketch. These are the communities in ISS. Take a look at those. If you are unsure where to go about ISS, okay, no one chat for a second because I'm going to put an email address in here, so don't push it down yet. If you have questions about ISS, I want you to email Sandy in the next couple of minutes. Here are the communities we have for Shift Lab registered. Find your community there. Note the population. So it may not be the Fremont County veteran team, but it's the chronic team. Note that for a second. If you have a question about Shift Lab, you can email Emma Beers, who's gotten quoted multiple times, damn. And here's System Flow. If you don't know what it is, don't worry, you're not in it. Don't worry. If you have a question about System Flow, email Habib Barader right there. And these are the communities that we expect are going to System Flow. Have you found your community? If you're not listed, You don't need to worry about it. And our final cohort that's launching this week, it meets tomorrow, not right now, is Last Mile. And you've all got my email address. You can email me. These are those communities. If you're coming to Last Mile, you're on this list. Okay. With that, we've got a little break. We went a little over. So if we want to start our cohorts at 1:35, that makes sense to me. So you've got like an 11-minute break. The evaluation link is there if you want to QR code it and move through that. And we are going to stay in this room, Garen, Star, me, we're going to help. If you have any logistical questions, talk to us. This is the first time we've done cohorts like this, so let's figure it out together. We're not stressed. We don't want you to be stressed, but take a break and then move to your cohort room if you have a cohort that's meeting today.